Subacromial decompression surgery is a common procedure for those with shoulder impingement. The idea with shoulder impingement is that the rotator cuff is being impinged between the humerus and the acromion process. And so subacromial decompression surgery takes out either the bursa or any bone spur formation on the acromion process to make more space in the subacromial space. But is this actually the best way to treat these syndromes? A recent systematic review and meta-analysis published in the British Journal of Sports Medicine looked at subacromial decompression surgery for adults with shoulder pain. The review included 9 studies with just over 1,000 individuals with shoulder pain. 2 of those studies were surgery versus placebo surgery, and then another 5 studies were surgery versus exercise alone. The review found that there was no benefit of surgery compared to a placebo surgery at 6 or 12 months on either shoulder pain or shoulder function. The review also looked at a surgery plus post-surgical rehab group compared to exercise alone, and what they found that there was no difference at either 3 or 6 months. At 12 months, the surgery plus post-surgical group had a small difference. However, the difference was so small that it probably isn't clinically significant, it's only statistically significant. The authors of the review concluded that subacromial decompression surgery provides no important benefit to the patients, and that further research comparing surgical treatments to non-surgical treatments was unlikely to change this result. Clinically, what this means is that subacromial impingement syndrome or rotator cuff disease should be treated conservatively. Subacromial decompression surgery doesn't provide any benefit when we're looking at either shoulder pain or shoulder function. And in fact, there's a risk of having these procedures done. It's been estimated somewhere between 5 or 6 out of 1,000 will have some sort of serious harm when having these procedures done. The treatment for subacromial shoulder pain should first focus on managing the loads placed on the tissues of the shoulder. Generally, at first, we'll reduce the loads so that way the tissues can calm down, and then we'll gradually increase the strength of the rotator cuff muscles so that they can tolerate the activities that we want to do. We can also look at the mechanics of the shoulder blades. So as we move our shoulder up overhead, the shoulder blade should move up with us, although there is some debate about the actual influence of that movement of the shoulder blade with impingement syndrome. Thank you for watching this episode on whether subacromial decompression surgery can be helpful for those with shoulder pain. If you found this information useful, go ahead and give this video a big thumbs up. And if you want to see more of my content, go ahead and hit the subscribe button as well.